similar to that second dot point, that second part of that second last dot point, where we're now looking at complementary and alternative healthcare approaches. So we're looking at the reasons for growth of complementary and alternative health products and services. We're looking at the range of products and services that are available, and also we're looking at how we can make informed consumer choices. So we want to be able to critically analyze complementary and alternative healthcare approaches by exploring questions like, how do you know who to believe? What do you need to make to help you make informed decisions? So if we look at this dot point, and like I said earlier, if you're thinking as a marker, you're making a practice question for yourself. You may make a practice question. You may sort of make questions, like for instance, name a complementary and healthcare approach, and what is the reason for its growth, or how can consumers make informed choices when it comes to complementary and healthcare approaches. And I may make that like a 3-4 marker, and then I'll have like my first mark awarded for you to actually give me first mark awarded to like for you to actually give me the definition of complementary and healthcare approaches. Second mark for examples. Third mark for actually summing up how they can make informed choices, or 2 marks for that specific part where how they can make informed choices. So if you think like marker and you get into that practice of making the questions, getting and that will not only help you think like a marker, but it will make you a lot more a lot more a lot more familiar with the syllabus as well. Okay, so complementary healthcare services, that is a health service which is sought by a person in addition to like the traditional or Western medical treatment. So it's complementary to that. It complements your ongoing treatment. Alternative is when a health service is utilized instead of a traditional medical attention or treatment. So there we go. So what are the reasons for the growth? Well, traditional medicines, firstly, are not may not be working for people, hence they're opting for like alternative services. There's growth of research into these products. They're being researched more, they're being developed more, so they are becoming more trustworthy and more and there's more evidence for their effectiveness. Hence why people are starting to use them a bit more. There is also the development of regulatory bodies like that have increased the credibility of these resources, like the Australian Natural Therapies Association. So they have been they're helping validate these treatments. Important to note that in Australia, you do not need to be actually registered in order to practice some of these alternative and complementary health services. However, if we are using these services, it's important to be aware, when we are addressing making informed consumer choices. Now, we also want to think about considering a more holistic and more natural approach to healthcare and treatment. And also, there is tertiary education qualifications that are available to practice these alternate and complementary health services. So that's why people are opting to use them more, because they're studying more. Okay, now here are a range of different complementary and alternate health services. So let's have a look firstly at naturopathy. So naturopathy utilizes the natural medicine approach, and it seeks to use natural products to strengthen your immune system and speed up the healing process. Naturopaths often treat patients by improving their diets or providing nutritional supplements using homeopathic treatments or herbal medicines. Aromatherapy, that utilizes essential oils from like plants in massage baths, inhalation, or like this topical application to produce different emotional and psychological reactions. They are, most are like calming, relaxing, therefore de-stressing, which assists in the recovery process. We also have acupuncture, which involves inserting fine needles into specific points on skin to applying various other techniques to the acupuncture points to restore balance and encourage the body to heal itself. And it is said to assist with like migraines and joint pain. Chiropractic, so they're treating the spine by using their hands to examine and treat different health conditions related to the bones and the muscles and joints. For some medical conditions, chiropractic services, they can be complementary or like a medical support, medical treatment by relieving the musculoskeletal aspects associated with the condition. So they are often quite popular complementary treatment based on what the condition is. Okay, now decisions. How do we make these decisions, right? So remember, firstly, research is a big one. You want to be able to ask someone who has used it, someone who's qualified, how they've used it. You want to research the person who is performing the procedure. You want to know what the side effects are, what the costs are. There is of course a lot of ambiguity, online as well, and there are unknowns when we consider complementary and especially alternative health services. So you want to be able to ask the person what questions like, what qualifications do you have? What is the treatment? What are the side effects? Um, you know, if so, are they common? Will the treatment affect any other treatments that I may have or may choose to have? So if they aren't able to answer it, or if the answer is a bit dodgy, you should be able to, conclude that they're not a reliable resource. So research here again is quite uh yeah, it's like, well, especially with alternative health services mostly, like there is a lot of research to do on the internet. The internet's not always reliable. So when we're answering questions like these, so if it's like an evaluate question, like evaluate how you can make informed consumer choices, for questions like this is where you'll go, okay, there's a lot of information on the internet, but at the same time it's unreliable. Or you can always ask the person, but at the same time, if they are, they may lie, they may not be reliable. So you want to be able to ask people who've already used it. So this is where you're sort of going pros and cons, and you're discussing the different parts of the question. After selecting, of course, it is important to reassess the effectiveness and determine if it's meeting your needs. So you don't have to continue through with it if it's not helping you out. And again, a useful resource, and in a question like this is worth mentioning, is the Australian Natural Therapist Association, that they are a reliable resource. You can check their website for registered practitioners as well, and you only want to perhaps rely on registered practitioners and not rely on non-registered practitioners. Okay, that's our last stop point, second last stop point over there. We've got one more to go, so let's smash it out. If you've got any questions about that, please ask. Let's smash that out, and then we are going to have a go at some of the practice questions that I've got for us from past HSC papers, and then we can answer a couple more questions and finish up. Cool. So now let's have a look at health promotion based on the 5 action areas of the Ottawa Charter. So by now you should be very familiar with the good old Ottawa Charter. We need to know the levels of responsibility for health promotion, the benefits of partnership in health promotion, for example, government sector, non-government agencies, and the local community, so that intersectoral approach, how health promotion based on the Ottawa Charter promotes social justice, and also the Ottawa Charter in action. So here you should be able to argue the benefits of health promotion based on individuals, communities, and governments working together, and the 5 action areas of the Ottawa Charter. So again, examples here are super important. Investigate the principles of social justice and the responsibilities of individuals, communities, and governments under the action areas of the Ottawa Charter. Critically analyze the importance of the 5 action areas of the Ottawa Charter through a study of 2 health promotion initiatives related to Australia's health priorities. So here you need solid 2 examples, because like you can get an 8-9 marker asking you how have the 5 action areas of the Ottawa Charter been implemented? Give examples to or name one initiative, or give examples for your initiative, something like that, where you actually have to talk about it. So let's firstly have a look at the 5 action areas. Now there's sort of 2 ways to remember it. There's DIPS CSAB. So developing personal skills, creating supportive environments, strengthening community action, reorienting health services, and building healthy public policy. Another one that I personally use that I like a bit better is dog crap smells really bad. Helps me remember it. It's a bit funny. Not very fond of dogs, so I always remember this one. So D stands for developing personal skills. C stands for creating supportive environments. S is for strengthening community action. R is for reorienting health services. And B is for building healthy public policy. So dog crap smells really bad. If you're a dog owner, you'll remember this one quite easily as well. So, firstly, let's have a look at developing personal skills. So, it requires the provision of information, education, and life skill development. This increases options and control for individuals over their own health. So, this is all about education. It is essential to equip people for lifelong learning, right? So, this is where we are educating people through school, home, and community settings. Education development of knowledge and skills is aimed at modifying their behavior. So, for example, doing PDHPE from K to 10, kids kids learn to do the five. Kids alive. Yeah, live is not the word supposed to do there. But kids do like kids alive do the five. Oh yeah, kids alive do the five. So you teach your kid to swim. So these initiatives are, obviously catchy. They're all about students, children and adults and students, and teenagers and the population, general individuals learning, good, like learning and being educated and being aware. Creating supportive environments, there is a link between people's health and their environment, right? So this is where we require a socio-ecological approach to health. So we need to look at the maintenance of environments, right, and how environments affect people. So work and leisure should be promoted to health, not demoted. Like now we see, like for instance, big companies having like relaxation rooms and stuff, like game rooms and stuff, not relaxation rooms, game rooms and stuff and things, in order to promote work and leisure. Thus, health promotion should create safe working environments that are enjoyable, assess health impacts of developing infrastructures. For instance, like now companies have also started implementing, like you don't have to sit on a desk, you don't have to sit in an office. Like they've got like the standing desks, so you can sort of you're not sitting every day, you're not sitting the whole day, like you don't have that sedentary work lifestyle. Obviously, there's also providing care. They're also providing care and support for people in various settings like work and school. So this is all about environments. Think of like school speed zones, no hat, no play, no smoking areas. That's all about reinforcing a healthy environment. Strengthening community action. It's all about communities working together, and community action is strengthened through communities being involved in setting priorities, making decisions, planning strategies, and implementing them to improve health from outcomes. So community would know what its people need. Like, if you live in a certain community, you would know what the health issues are. Let's say you live in an area with a lot of elderly people, so things like people not exercising enough, like they're not able to go out enough. So those are like community priorities that you will bring up to the council, that you'll bring up at meetings, and those are then addressed. So the process's goal is to empower communities. For example, think of mothers and babies group, walking groups, self-help groups like Alcohol's Anonymous. So it's all about encouraging communities to increase participation in decision making, planning, and implementing of these services. Reorienting health services is about the shift towards a system that promotes health rather than curative services. So, health services need to support the needs of individuals and communities to promote health and prevent illness by considering social, physical, political, and economic environments. And this, of course, requires a greater health research and professional education and training. The shift, again, is on preventative care. It can, again, this one's a bit of a tricky one, but think of, this is all about prevention. We're focusing on the needs of the entire individual, not just, on the injury or illness or disease. So it's about prevention, it's not about cure. So there is that shift from curing what's wrong, and rather there's a focus on the holistic health before the illness even begins. So if you've got, for instance, like there's a smoker, who goes to their GP, the GP is focusing on asking them to use quitline health services and stuff. So that's reorienting the health service. They're not focusing, they're not curing what's wrong here. They're not starting a cure for lung cancer. They're not like, all right, let's start working on lung cancer because you're smoking every day. You're going to get out at some point. Obviously, that's a very generalized example. That just to give you an example, they're rather focusing on the holistic health that the person needs to quit smoking. They may have other issues going on which actually leads to that. So they may direct the person also towards like mental health support and things like that. So it's about refocusing the health services toward prevention. Another example is free screenings for skin and breast cancer, which encouraging the cessation of smoking. Now, building healthy public policy. This is all about, this is where policy development at all levels is seeking to promote health. Like it includes legislation, taxation, and organizational change. This is about laws and regulation, right? So they're made to foster equity and ensure safer and healthier goods and services. Think about like I think the biggest example here is sort of like RBD legislations, kids alive due to 5, fancier pool, and smoking bans and taxation on cigarettes. Like those are your big ones. Okay, now levels of responsibilities. How are communities, individuals, and governments working together? Let's have a look. So developing personal skills. So for each one, let's have a look at governments, communities, and individuals. So governments, they create policies and fund education to develop personal skills, right? Think of your PDHPE education from K to 10. Communities, then those run those education training programs to help develop personal skills, like community health center education, or things like street smart and stuff. Then look at individuals. They participate and take own responsibility of education using the resources provided. Examples: signing up for locally run education sessions, attending school. Then we've got creating supportive environments. So governments, they plan, implement, and manage the infrastructure, like pathways for walking in parks. There's waste removers, sun shelters. There are also now exercise equipment in parks. Communities, they help maintain healthy environments and they promote healthy behaviors. Now, community, for example, Clean Up Australia Days, fun runs, they maintain parks. Like you would see, like local exercise groups, as well in parks now with the equipment installed, and individuals need to use those resources implemented. For example, put your rubbish in the bin, keep the environment clean, and also support the health choices or join up those local exercise groups. Now, strengthening community action. So, governments can engage with community groups in the creation of policies. They can allow communities to provide feedback on policies before actually signing them, simply because remember the communities would know what their people need the best. So as a whole, if they're involved in the decision making, governments will obviously be spending their it would obviously mean that the money is spent effectively more than anything else. Communities have to they need to contribute to and take ownership of policies that are being empowered. For example, Aboriginal community controlled health services. Finally, individuals getting involved in and promoting community activities like promoting fun runs and engaging in community discussion and health issues. Okay, reorienting health services. So governments, now this is quite an interesting one for governments. Like they're providing funding, research, and creations of policies around prevention and health promotion. So they're looking at the determinants, not just the cure. Like we spoke about, why that's so important in prevention. So think of like TV advertisements, training of primary health sector to promote health as well as cure. Then we've got communities, so they conduct research and be involved in the promotion of the health. For example, Cancer Council conducts research around cancer, but also promotes better health choices in relation to the prevention of cancer. Then individuals participate in health promotion and taking responsibility of those preventative measures. For example, participating in jump rope for heart or getting advice from a GP on quitting smoking. Finally, building healthy public policy. Governments, they create and they're responsible for the creation and maintenance of policies. So close the gap, statement of intent. Another example is the National Tobacco Strategy, under which tobacco smoking is prohibited in certain areas, and the branding on cigarette packs, also includes warnings. Communities, they contribute towards developing and carrying out policies. For example, Aboriginal and Torres Strait Islander peoples involvement in close the gap. And finally, individuals acting in accordance with policies, like abiding by those no smoking zone rules as well. Okay. Now, holding imaginary hands of partnerships. Now, partnerships equates to sharing resources, right? So shared responsibility equals that there's more efficient, there's more time efficient division of resources for health promotion initiatives, increased access to expertise and resources, community and NGO involvement mean that policy and health promotion will be targeting actual needs of the population, right? Governments provide research and funding, individuals are the stakeholders that invest the money, but they also partake in those initiatives, which underpins the success, evaluation, and future improvements. So this is all about that intersectoral approach where all parts of the communities are working together to improve health and influence its determinants in and sorry and its influence its determinants. Determinants is often referred to as that intersectoral action of approach. Okay, now let's have a look at a case study. So we've got breast cancer mobile screening van. So as a result of this collaborative approach and this program, breast cancer mortality rates have decreased. Now, putting it all together. So the OC and the SJP. So the Ottawa Charter and the social justice principles. This is that last part of the left-hand side of the syllabus. So developing personal skills. Equity is also access to education for all Australians, right? So now it's about adhering to those social justice principles within the Ottawa Charter. So for developing personal skills, we want everyone to have access to those resources. Again, like PDHPE is easily accessible as it's provided during school K to 10 and there's no additional fee. Diversity education programs are modified to cater for the diversity within the population, like health classes, pamphlets, textbooks, and advertisements in different languages, utilizing images to cater for those with lower health literacy. Supportive environment, so people share their skills and knowledge within their environment, making it more supportive. Example, parents are educating their children and modeling for their children who do the same in their peer groups. For creating supportive environments, again, equity, health promotion is built, health promotion that is built to achieve a supportive environment means that it considers everyone. For example, Alcoholics Anonymous is open to the public, allows a safe environment for all the people to be a part of it. Same thing with the no smoking zones, right? In bars and pubs, it creates an environment free of passive smoking for everyone. Diversity, in order for an environment to be supportive, it needs to account for the different people in that environment. So PCYC, Police Citizens Youth Club, so implementation to support the health of young people accounts for the diversity of a community in that young people also have health needs. So now we're focusing on health needs also according to age. And then finally, supportive environments. So creating environments that encourage healthy choices is vital in health promotion. So ensuring there are good parks for outdoor activities and like exercise equipment in all parks in all areas. Now, strengthening community action. So equity, all. That means that everyone is involved. Aboriginal and Torres Strait Islander people get involved in Close the Gap program, which allows them to strengthen their community while improving the health outcomes for their population. Diversity, it's about empowering like elders in Aboriginal communities and encouraging them to implement and to lead and address those health issues in their communities. And promote diversity of knowledge and acknowledgement of diversity of cultures within Australia. Then finally, we've got supportive environments. So health promotion that aims to strengthen community action by getting communities to address health problems by creating supportive environments in which the health problems can be addressed and also we can create solutions. For example, community volunteer groups maintain bushwalking tracks to create an environment which is supportive of exercise, but which is also safe at the same time. Reorienting health services, providing equity. It's for everyone. So providing free or subsidized screenings to all Australians via Medicare, which promotes equity. Diversity, ensuring promotion of screening and preventative initiatives in like multiple language through multiple channels. Finally, supportive environments, so immunizations in schools to prevent spread of disease in school and create that safe environment for all students. Finally, building healthy public policy. So, equity policy making in Australia is built to cater for all citizens, making it equitable. Like Medicare provides access to health services for socioeconomically disadvantaged people. Diversity public policy announcements for the diversity of our population, which seeks to provide, which is provided to all people groups. Also, policies to ensure resources are accessible in different languages. Like that's a main one here with diversity. Finally, supportive environments is that policymakers should aim to produce policies that promote supportive environments. It's about creating a healthy environment for individuals. So, I know that was a lot, but in essence, what we're saying is that the Ottawa Charter provides a framework upon which those health initiatives can be based on, right? And they will subsequently promote the social justice principle. And that's, your overall answer statement. That's what we're saying, that, the Ottawa Charter needs to be backed, needs to promote, so the health promotions, health initiatives need to be based on the Ottawa Charter framework, which will promote social justice principle, and then you want to give examples for each one. Intersectoral approach is one that involves all groups, including the government, including NGOs, communities, and individuals, working together, sharing their resources. OC in action. So there's the National Tobacco Strategy, which was implemented from 2012 to 2008. So DPS, it's about educating people. You can see the warnings on their cigarette labels. CSE, creating supportive environments. It's about supporting people to quit, right? So we've got posters doing that. And that, of course, will then also, link back to like social justice principles where there's the diversity, everyone is able to access these. The same thing here as well. Life skills, strengthening community action. So this is about promoting those life skills, about communities working together. Then we've got reorienting health services. So they have increased quitting by 50 to 70% by implementing, my quit plan, implementing apps that people are able to use. Finally, building healthy public policy, so using laws and taxes as a way to reinforce that the healthy behavior, and they've done that, and you can access the article there. But for instance, the most expensive country in the world to buy a cigarette is Australia. A pack of 20 cigarettes now costs £19 after the latest tax hike. So there has been, we've implemented higher tax rates for cigarettes and tobacco products in order to deter people from buying them. So now, studying. Example, syllabus, and practice. I've talked a lot about it. Remember, understand the word. Make sure your response is easy to read and it's relevant. You don't have to use super sophisticated language. Multiple choices process of elimination, so you find the most correct answer. Now we